This looks good. We're rolling.
Okay.
Excellent, excellent. So, first of all, thank you for all the people who are watching and listening. Appreciate you joining us and tuning in. Always trying to bring information that'll be helpful and we can all learn something. And so today I have a friend of mine back again for a second interview. He is somebody whose work I've admired for a long time now. And well, I'll just introduce him right now. His name is Dr. Luigi Boccuto. And thank you, Luigi, for being with me again today.
Thank you, Carl. It's always a pleasure. And thank you to all the people listening. You're too kind with your words. I always enjoy the opportunity of communicating and sharing not just my work, but also, thoughts, considerations. I think that science must serve a purpose, and part of that purpose is
absolutely. And I'm bringing something up here for people to take a look at. I've listened to this, I don't know how many times, quite a few. I really enjoy this TED Talk you did.
Yeah, thank you.
Personalized medicine. So, yeah, folks, get on and check out Luigi Boccuto on TED Talks. Just go to YouTube. And that's really, it's short and sweet. It's like 9 or 10 minutes and love it.
Thank you.
So, well, we were talking before we got the camera rolling here. We were talking a little bit about, well, so right now it's my son's birthday today. It's April 14th.
Oh, happy birthday.
Not too far from you.
Mm-hmm.
And he's an emergency room doctor at Emory and just starting his third year residency soon. But anyways, he's seeing some COVID coming in there, and we're in the midst of this COVID calamity, if you will, and the situation which is so unprecedented. And you mentioned to me you've been doing some work in that area. Would you mind sharing what it is you're doing in regards to COVID?
Yes. So even if COVID is not primarily a genetic disorder, and I'm a medical geneticist by formation, I think that this is something so big and unprecedented, as you said, that probably every member of the scientific community should feel kind of involved, because this has literally paralyzed any social activity, but in many cases also any work activity all around the globe. So I have been involved first in some groups with some colleagues and professionals all over the world. And then, when you put people together, ideas may stem up and may develop into projects. So I've been very, very grateful for being involved in some of these projects. And I gave my contribution about providing analysis, providing point of view, providing new ways to interpret the numbers that have been generated in these months, in these weeks, really. Mm-hmm. So some of these projects were focused on interpreting some epidemiological trends. We just got a paper published a few days ago about the trends in Italy up to the end of March. And as you and many people listening to this probably know, Italy has been hit, particularly bad, especially for the countries in Europe. The pandemic started there towards the end of February, and the numbers started to increase dramatically. Now it looks like the trends are slowing down, and so in this paper we actually were able to analyze these very first signs of the inversion of the trend, and interpreting the mechanisms that might have led to that decrease in the spreading of the contagion. Other works have been focused on procedures that involve autopsies, or in general any sort of interventions on the body of people with infections by coronavirus. And other projects have been involved in looking at early signs and with the intention of identifying either people with apparently no symptoms or people that are about to develop some symptoms.
Mhm.
So I think that this is something that has been discussed and presented in other occasions. So I'm not scooping too much, but one of the early signs is the loss or reduction of the sense of smell and taste. It's been discussed thoroughly, and apparently this is something that either is overlooked. So some patients do have it, but they don't pay attention, they don't realize that this is happening, and they might be classified as asymptomatic, so showing no symptoms, because especially in the very early stages of this disease, of this pandemic, we were expecting almost always a very severe presentation. So having patients that were just showing a mild cold and this sense of loss of smelling, didn't really feel like those patients could be considered symptomatic.
Sure.
But in fact, this has a very, very dramatic impact on the spreading of the disease, because the estimate is that about 70 to 80% of people that do have the virus, so they did get infected, are actually showing no symptoms or very little symptoms. So this is important for the mechanisms of spreading the virus. So the better we know about these people, the better instruments we have to identify these people, the more chances we have to limit the spreading of the contagion. So I know that the World Health Organization, in an ideal scenario, recommends to perform the test on everybody, because that's the only way, to give you a precise idea of the status of the contagion of the virus. And in some areas, this is possible. Unfortunately, in some areas, this became possible because of the large number of cases. Let's think about the New York area in this moment.
Yeah.
Areas that are social or logistic or financial issues that don't make this very feasible. So I know it seems like a large loop, but if we think in terms of personalized medicine that you were mentioning before, personalized medicine can only occur if you are in the position of collecting as many information as possible about the individual. So this is a new scenario. This is completely unprecedented and in some way destabilizing for the way we perceive the healthcare system. And so being tested, even if asymptomatic, being tested even if feeling normal, it's the new normal, because really, if we don't identify the people that are carrying the virus, especially among the healthcare personnel, we really are limiting our impact on the healthcare that we can provide, on the help that we can provide to these people. The incubation time of this virus spreads from 2 to 14 days, with an average of about 5 to 6 days. That means that people can get in contact and carry the virus for a week or two before even showing symptoms, or they might never show symptoms. So imagine how many people get in contact with each other in closed spaces, and they will spread the disease.
Right.
Everything is depending on the capacity of intervening really early. So we need to know who has the virus, to monitor that person, and to intervene on the symptoms very early. Because at the moment, there is no specific therapy for this particular virus, the SARS-CoV-2, which is the denomination of this particular strain of the coronavirus, which is a member of the coronavirus family. So all the therapies that we have are quite generic therapies that work on antiviral drugs and work on anti-inflammatory drugs, because there is a first stage of the disease that depends on the infection or the spreading of the virus inside our body. And then there is a second stage whose symptoms depend primarily on the spreading of the inflammation. So most of the damage, especially in the more severe cases, most, if not all, the damage is actually caused by our own immune system. There has been reported what is called a cytokine storm. So there is this massive inflammatory reaction that involves actually many districts, and this is another field of interest in the research on COVID-19 that is spreading. It's not just the lungs. The lungs are involved very severely. We know that there is this interstitial pneumonia, but there are signs that make us believe, there are proofs actually, it's not a matter of belief, that other districts are involved very severely as well.
Wow. Geez, that's, I'm trying to wrap my mind around that right now. So it seems really complicated, actually. You know, and one of the things that crossed my mind, and I don't want to go off on a tangent, I'll try not to, but one of the first things I think of in my line of work, given the population I generally work with, is Parkinson's and other movement disorders, is that sense of smell is often diminished there too. Mm-hmm. But usually by the time I see them, it's been a while and they already have a diagnosis. So sense of smell could have been years before. But so loss of sense of smell may not mean COVID, yet it's something new that it could mean that it didn't used to mean, right?
Yes. And this is my personal opinion now, but I think that many of us are no longer really accustomed to rely on the sense of smell. I mean, how many people go through the daily routine without really, smelling the roses, like slow down and get, in contact with the sensory stimulation, of smelling. I mean, sometimes you smell a nice cup of coffee, but, most of the times, let's be honest, we just drink the coffee and go on with our routine. And, and there might be, smog or pollution. So really you don't smell flowers or any natural odors and things. So we've been, evolutionarily, we've been losing gradually our sense of smell because it's no longer functional. It doesn't add that much advantage to our, quality of life. So I understand that in many cases, reduction or loss of the sense of smell doesn't really impact our life to the point that we pick up the phone and we call the doctor, say, hey, listen, doc, I mean, I'm not smelling things very well. Mm-hmm. But in fact, the thing is that the sense of smelling is involved with the way we taste our food more than we think. So right. What we consider the sense of taste is, for what we have in our buccal apparatus, the tongue, we have, it's very limited to very basic stimulation, to very basic flavors. But the whole palette of flavors that make the complex sensation of how food tastes depends a lot on our smelling. So it's really the symptom that many people report that in the midst of being sick, of having high temperature, and everything else, they said the food tasted like nothing. I couldn't enjoy, eating something because I couldn't really taste it. But it's more depending on your nose than on your tongue. It's just that we don't know.
Yeah. So let's say somebody does notice loss of sense of smell quickly. Mm-hmm. Is there a difference between, let's say, loss of sense of smell and COVID as a symptom compared to, let's say, Alzheimer's or Parkinson's, would that be a diminished sense of smell over a longer period of time versus COVID?
Yes, you're right. The most important difference is that the sense of smell in Alzheimer's or Parkinson is more in the long term. Okay. So in some way, in COVID is more abrupt, especially because it's often followed by high fever, by dry cough, all the other symptoms that are typical of this infection. And generally, it resolves once the infection is over. So there is this chronological difference, but I don't know if in terms of the type of smell, like if you lose the sensation for certain smells but you retain for others, I don't know that if there is an important difference between the loss in Parkinson and Alzheimer and the loss in COVID.
Interesting. Yeah. Well, my wife and I, when we walk around here, and we joke around a little bit about it, but the other day I was sauteing some onions downstairs, and she's from upstairs saying, "I smell onions, that's a good thing."
Yes.
So, yeah, because it's actually one of my favorite smells. I love sauteing onions and garlic and peppers, and we can still smell it. So.
You realize that your body works, right?
Yeah, right. So this is interesting. So, what is there anything more you want to say about the COVID, just to share with viewers? Because
yes, I know
there seems to be and I'm sorry, I didn't mean to interrupt you. There seems to be a lot of obviously a lot of unknown right now, of course, but fear, in some cases, a lot of fear. Okay, yeah, go ahead.
Yes, I know that I'm probably restating the obvious, but I want to stress the fact that just because we don't have a vaccine, we don't have a specific treatment protocol, I want to reinforce the concept of maintaining social distance. That is right now the only certain strategy that we have, and that is proved to be effective against this pandemic. We have very good examples coming from countries like Japan or South Korea that were hit early and were able to manage a very strict series of countermeasures promoting social distancing or social isolation, and were successful in promoting that, and people were very diligent in observing those rules, those recommendations.
Yeah.
And now they're virtually out of the curve of the spreading of the virus. But I like also to mention the example from Italy, because I think that there's a lot to learn there, also from the mistakes. There is a virtuous example and there is not so virtuous example. But before we started recording, we were discussing about the differences between the spreading of the virus in the north of Italy, in certain regions, Lombardy, for example, where the city of Milan is, and in the south. So obviously, the main areas that get involved early are the ones in the north, and so the Italian government took some decisions about isolating certain provinces there. There were 16 provinces that were declared red areas. So basically, they declared that they were locked down, so people were not allowed to go around or travel and everything. There was something, without entering the political field, which is always very delicate, but there was something that went really bad, because the news of that government decree leaked, and even the CNN announced that decision, that decree, a couple of hours before the official announcement.
Oh,
so it leaked really bad, not just internally in Italy, but all over the world. And as a consequence, a lot of people fled out of that area, so those 16 provinces, heading south in many cases, because in Italy we have a lot of south to north migration. So we have young generations, but also all generations that have moved to the north, looking for jobs, for university, education, and things. And so a lot of these people in the night just took the train, took whatever they had, and went south. So they really escaped this lockdown in these 16 provinces. And this is bad. But sometimes you can get something good out of something bad. About silver lining. In front of this, failure in containing the virus in these 16 provinces, a couple of days later, the Italian government took the decision of declaring the whole country a red zone. So they expanded the lockdown measures to all the regions. That made a huge difference in the epidemiological dynamics of the spreading of the virus. Because
Mhm.
the lockdown that interested the southern region occurred much earlier as compared to the first cases than in the northern regions.
Okay.
That is critical because the government, like in many other countries, without saying names because again we stay out of politics,
It's okay.
but deciding to have a complete lockdown, shut down a lot of economical activities, it's very delicate. It has a lot of impact on a lot of families and everything.
Sure.
So the government didn't take the decision very early in the northern areas because incidentally the northern areas are the most important in terms of productivity, economics, financing, and so on. And so there was a certain time between the first cases and the lockdown. So the numbers started to spread there, it started to increase. But due to that escape, due to the leak of news and those people traveling south, the lockdown in the southern regions occurred relatively earlier as compared to the north from the first cases. So
Okay.
to give you example numbers also for the listeners, in Lombardy, they already had passed 1,000 cases when they went put on lockdown, while in the southern regions, they had only like 10 or 12 cases, and they were already put on lockdown. So that is one of the reasons why the numbers stayed low in the south.
Okay.
Because the measures were taken, more, they were just taken earlier.
Earlier
Was
in relative to the first cases, you're saying, yeah. And
So
your family's in the south of Italy, right?
South, yes.
And you said off camera, you said they're okay, so I'm very glad to hear about that.
Yes,
Yeah.
thank you. So this is just to give you an example of how important it is and how impactful it is to stay home and observe social distancing. Like I said, we can learn from mistakes and we can learn, from virtuous examples, but we do know that this strategy is effective. I know it affects economy really badly, especially for people that have small activities, they have to basically give up their income by shutting down their activity. But it is the only weapon we have in this war against COVID-19.
Really, it's just really interesting. It's, I have a lot of thoughts about it. First of all, I wish it never happened in some ways, because who needs COVID, right? We don't want to have that. But when we're dealt something that's, out of our control, let's say, at least initially, there are a couple of different ways to respond. You can be negative, or you can try to look at all the upshots from things. One thing I noticed, that even though I'm not working at the university, so there's no money, and I'll get by. I'm going to get through it. I'm not terribly worried, but at the same time, I have slowed down. So, and I had already slowed down last year because of the health issues I had when I arrived in Singapore.
Yeah,
and I was grounded
in your leg.
Blood clots, a huge DVT in the left leg. But anyway, besides, I'm fine, right? Had a hip replacement 4 months ago. I'm doing great. I'm really lucky. But I needed to slow down even more. So there has been a shift in my perspective of things too. And I've noticed something, because I've lived here 27 years in this house. So out there is a river, and along the river is a trail, miles and miles and miles. I don't know how many miles, 20, 30 miles. 50 kilometers worth of trails, and I'll go out and I'll ride. For all these years, my bicycle used to run. I don't run anymore because of the hip, but anyways, ride. I'm seeing more people out and moving. They have masks on, and they're usually, a couple together or a family masked up pretty well, but I've never seen so many people out and moving about, and that's kind of a nice thing to see. And I don't know about down in South Carolina or in Italy, but right now it seems like people are a little friendlier here.
I think this is a humbling experience.
Yeah.
I know we're probably, leaving the scientific conversation, more talking about social or, even philosophical conversation. But hope your listeners won't mind.
Oh, no, they're going to love both. Yeah, they love it.
I think that this has made us reconsider our perception of time.
Mhm.
We consider time as an instrument in our hands. I have time to do this, or I don't have time to do this. So it's something that we use to do things. But really, we're just immersed in the stream of time. We can control time, and in this case, time has been really stripped out of our hands in two ways. One, we have this abrupt, unexpected condition that may unfortunately put some of us in ICU, struggling for our own lives. So it's an invisible enemy that will really can really take you down, and that is of course terrifying, very destabilizing for our ideas of controlling our life. And in the other way, time has been stretched out, expanded. We have so much time in our hands without anything to do, and really we are reconsidering, the 24 hours, because we're so involved, sometimes even submerged by our work duties, and we ran a very tight schedule every day, and now we realize how many other things we can do instead of just working, or
Mhm.
on top of working. I know that a lot of people, including myself, are working from home, and this is a completely different dynamic, because you go to your office, you sit down, you start working, and then when time is over, you come back home. With working from home, you can have a more diverse experience. You can still work and do other things at the same time, taking breaks, interacting with your family, or your backyard, a lot of things. So I really think that for some people, this has been a chance, like you're saying, if you want to look at the good side, still considering that there are people dying out there and there are people
Yeah.
struggling. So let's not forget about this. Like you said, who needs COVID? I wish that we could be given the chance to make this same consideration, this same changes in our ways to see our own lives without struggling with the deadly disease. But
Yeah.
for some people, this has been a chance of putting their life on hold, like their old life. In some cases, even hit the reset button, like saying, well, if I look at things, I really don't like the way my life is going. I really don't like the path I've been on, because I realized that my body is showing signs of insufferance. My health has been, showing signs of intolerability. I'm not happy with what I was doing. And now I have this reset situation, and I feel my body working better. I feel my mind being clearer. Especially in the Western countries, the work pace is really causing a lot of stress. And if we consider night shifts, if we consider work commutes, if we consider, all the types of sacrifices that a lot of people make to adjust to their work life. So this is the critical thing: adjust, because they put work efficiency, because they are providers. They need to, bring money at home. They put work on top of everything else, even time. Now, a lot of people are realizing that there is nothing on top of time, because time is the most precious thing we have in our life. It's not up to us to control it. And it really opens the gates to a lot of things that are not just work. So I think, and I hope for many of us, that this will be a unique opportunity. Sometimes we always say once in a lifetime. Well, I think this goes even beyond the lifetime. This is so unprecedented, because one, I think that compared to other pandemics, this has been spreading way faster.
Yeah.
The world has become, a much smaller place. A lot of people compare this with the Spanish flu that hit about 100 years ago. But the
Sure.
Spanish flu hit over a time of 2 years. It took
People weren't doing international commuting.
exactly.
I mean, maybe, I don't know if anyone was then, were they? But they are now. So yeah. So
The flight, the commercial flight, system was not in place today.
So I don't even remember the first transatlantic flight. Might have been in the 20s, but still, right?
Yeah.
Over a 2-year period, it hit. Yes.
Yeah. So this is something that hit everybody, in such a short time that is unprecedented. Also, this is something that was of public knowledge in such unprecedented way. As soon as China started, sharing knowledge about this, which was back in December 2019, there was this first wave that interested few areas like the Pacific states in the United States. There were cases in Seattle, in the state of Washington, Oregon, California.
Right.
It didn't spread like that, but then coming February, there was this second wave of spreading that really hit everybody. And now it's something that has been hit the northern hemisphere, as well as the southern, the west, the east, everybody. So I think this is really unprecedented. So it's more than once in a lifetime. Yeah. It's probably once in, dozens of generations.
Yeah.
And like you said, it's also a unique opportunity to give a different look at things.
Yes. I'm still adjusting, and I think this adjustment may continue for quite some time for a lot of reasons. Well, two primary reasons I think of is as I move forward adjusting, I keep thinking about what I was doing and more figuring out how can I focus more so in what can I do that's going to be more effective, help more people, or whatever. I didn't even know yet. I have ideas. I just know I need to get my book done, which is happening so close. I've never written a book. But the bottom line is, I think this will be a long time. As a friend of mine's, I have a friend I was talking to last week, his daughter, I think she's 11. She said, Dad, she's the greatest girl. I love her. That we're living history right now. We're not just looking back and learning about history. This is history, and it's huge. Says, how profound for 11 years old. And she's right. We're in it. We're in it deep. And for the rest of our lives, and how many hundreds of years are people going to look back?
I was just joking. Of course, I agree with the little girl and what you're saying. I was just joking yesterday with a friend of mine and saying that there will probably soon be another dating system other than BC and AC. Will be before coronavirus and after coronavirus, because so there'll be like a BC and then AC BCO. So after Christ but before Corona, and then after Corona. Now, jokes aside, and I don't want to be, of course, disrespectful, but I think that this has impacted the whole world in an unprecedented way. This has been impacted more countries than World War II. There are more countries involved, in this that had to shut down their activities than the countries that did shut down their activities in World War II. Yeah. So.
It's on a scale that I don't even know if we can't even measure it yet, can we? Because we don't have a long enough time span to collect data. I mean, we can start now, like you've done, but I wonder, what's it going to be like in 6 months, a year, 2?
Well, yeah, because first of all, we don't know when this is over.
Mm-hmm.
I know that there are a lot of countries that are already thinking about restarting some activities, and I'm no expert in economy, but I do understand that if you keep things shut down for too long, it'll be really hard to restart. Some people, they just will declare bankruptcy. They just have to shut down their store forever. And of course, nobody wants that. But we really don't know when we're going to be over. The ultimate answer will be the vaccine, of course. And even with good vaccines, you reach a coverage of like 70% of the population. And that brings us to a completely different topic that will be, herd immunity, will be isolating people at risk, all these things. But at least it's the first line of defense.
Yeah.
But
Right.
we'll hold not just for COVID-19, because by the time the vaccine will be available, which is likely, the end of this year, the beginning of next year, but it's reasonable to expect a second wave, a second strain, which is probably going to be COVID-20. Just like we have for the flu, every year there is a new strain.
Right.
So we need to be prepared for that. And, I'm really concerned, for example, about the southern hemisphere now that is going towards winter. And, winter means a lot of other comorbidities, from cold to flu to other sources of respiratory infections that will make things worse. Of course, I'm not wishing for that. I hope this is not happening. But knowing the dynamics of spreading, the weather is a big factor.
Wow. Yeah, actually, I had wondered about that. So please forgive me for not knowing this. I feel like I should know. And I feel I thought one thing, but I was wrong. So do viruses tend to thrive more in cold weather or warm weather?
Well, there are studies to show that the virus does not survive outside, because the key point is not how much it survives in us or how much it can be spread in a short proximity, with another person, but how much it survives on objects and surfaces outside without interacting with human body. And it looks like the survival time is drastically decreased when the temperatures go above 26 Celsius degrees.
Okay.
So warm weather does not facilitate the spreading of the virus. That is what some studies seem to indicate.
All right.
However, of course, if we're still talking, within less than 6 feet, we can still spread, just by
Sure.
dropping
Particles. Yes. Okay.
So the point is that it's not just that. It's not just about the virus. It's about what else is going on. The categories at risk, at higher risk, involve people with other cardiorespiratory conditions. So obviously, the people with cold or flu and complications of cold or flu are, more numerous in the winter. You tend to have this sort of seasonal infections. So having a person that already has a bad case of flu or already has a cardiorespiratory problem and goes through the winter, and then having that person exposed to the coronavirus clearly configurates a more severe clinical presentation. So it's not just about how much the virus spreads, but it's also about how well we can take the infection by coronavirus.
Yeah, I've been, for not to get off track again. I just I can relate to the fear out there of having corona, maybe because I've had a history in my life of upper respiratory issues and infections. There was a period where it was about 2.5 years, a few years ago, of chronic bronchitis. I was always, it's like I was in 9 rounds of Biaxin, the super powerful antibiotic that pretty much tore up everything inside. But that didn't, after I finally got through that phase, I did get pneumonia twice. I'll tell you, it's just nothing to mess with. So been real good now for just over 2 years. Real good. No respiratory issues, really working on being healthy. A tangent could be, but I won't do it, is my dietary lifestyle and what causes me to, I think maybe, I don't know if inflammation or certain things I have sensitivities to that cause mucus and all that other kinds of issues. But bottom line is, I certainly don't want to get COVID, and I also don't want to spread it. So seems like social distance is the way to go. It seems like the best way of control, like you say.
I can tell you this. I have been showing the symptoms and never got tested. So I don't know if I did get it, but just to share my personal experience, I I was flying back from Australia, and you know very well how long it could be those flights,
Yeah.
and also how confined you could be for like 15 or 16 hours on the plane.
Yeah. Yeah.
And I'm sorry, I'm bringing
Oh,
back
no,
some
no,
bad
I'm okay.
memories, you know, about
I'd love to go to
Singapore.
Australia, you know. I
But
haven't been there yet.
so I was there for a conference for work reasons, and a couple of days since I got back, I got sick with what now I realize are the symptoms matching what is described for coronavirus.
Mhm.
So I had high fever, with temperatures above 101 Fahrenheit. I had, very heavy cough, dry cough, but chest pain too, loss of smell and taste.
Oh, fine.
So, but I didn't get tested because back then the guidelines were to wait for over 3 days with high fever before going to the ER. But nevertheless, the point is, we now know that the degrees of severity may change.
Mm-hmm, mm-hmm.
And that is why we need to be very much alert about the presentations, because it's not just about us. Like you said, it's not just about the fear of getting it, but also the fear of spreading it.
Mm-hmm. Yeah.
And, being aware of the people or the environments where we've been, we might have been exposed or not to the virus, being aware of mild symptoms, of mild discomforts that we might present. All of these things are really helpful for us and for the people near to us.
Yeah. Yeah. Back in the beginning, it was hard to wrap my mind around the fact that social distancing, 2-3 months ago was probably going to be a thing here, and then it became a thing. I remember the day they shut down the university, or they announced it, and so it got announced. Then a few days later, they shut down, and everybody left, pretty much. It was hard to believe that this would happen, but you know what? I see it now because it's all over the news. You see the numbers. The numbers are staggering numbers of deaths. Very sadly. Yeah, I don't know what to say about it other than learning from you is always, first of all, I really thank you for joining and being here and sharing about this. I learned a lot. Thank you.
Oh, it's my pleasure. Like I said, both at the personal and professional level, I believe that sharing is very important, especially nowadays. We live in a world where, a person from Singapore can share with a person in California.
Yeah, isn't it great?
And, sharing is giving, and in these cases, sharing is sometimes even saving lives. Knowing about, early signs and knowing about something, some manifestations, some features of the disease that was unknown may be critical for an early diagnosis and early treatment. Let's not forget that even if the categories at high risk involve people above 60, everybody can get COVID-19. Everybody can get severe presentation and complications that might lead to hospitalization and ICU. So I don't want to spread anxiety or panic, no, but I want to spread a sense of responsibility. We are responsible for ourselves and for the people around us. This is very important. So wearing masks, washing our hands or wearing gloves when we go outside, really considering that our house is a safe territory, but everything outside our doorstep is a dangerous territory. It's something where we don't know if there is a contagion risk because of people that have been passing by or infected surfaces. It's always something that we need to be aware. Not that we need to live in paranoia, but like you were saying before, this is not going to stop with coronavirus. We have been given the chance to rethink our ways. We were talking before about long travels, and I'm sure that even when this is over, a lot of people will wear masks on long travel. I'm sure that we will be more aware about physical contact, about spreading germs. because coronavirus is not the only thing that is out there. And when you are sick for 15 or 16 hours in a confined environment with limited air change, there is a high chance of sharing germs.
Yeah.
And now we see that, unfortunately, in the worst case scenario, but that doesn't mean that once we will have the vaccine for COVID, for the SARS-CoV-2, we'll be immunized for everything else.
Exactly. Yeah. You know, what's interesting is I had been wearing masks anyways. I bought a whole bunch of N95 masks a couple years ago, and I didn't go through that many of them because I tended to wear them on the longer trips. So I was flying, from here to Atlanta. It's 2 hours, and I didn't feel, maybe I should have worn it. I don't know, but it seemed to be okay. But I felt I don't really need to have N95s laying around here. I sent them all down to my son and his wife, who both work in emergency rooms in Atlanta, because they need them. I have one here, and I have some other masks too, which are fine. But I had been wearing the mask because I have this tendency, Luigi, if you didn't notice, I'll go off track a little, but it's always with the intention of coming back, is the idea of being cooped up in a plane. The trip to Singapore is just so long, and then South America and Dubai and all these places. And it just doesn't feel good breathing that air. 3 or 4 hours is one thing. 15 hours that's different.
Yeah.
And it's so bad for me physically. And I think probably for most people. I was talking with a friend of mine in England yesterday he was traveling more than I was. And he said, I didn't realize the toll it had taken on my health without Corona in the world. And he says, I'm reassessing everything because maybe I just won't fly nearly as much anymore. I'll do more online education. But I could see people, I'm a little bit of a germaphobe. I could see more people becoming, wearing masks after the Corona too, just like you said. That's my long-winded way of agreeing with you.
No, I agree. And this is, to circle back, this is part of that reset process. A lot of people will really rethink what they gave for granted and what they were doing, automatically as daily routine. And not just because of Corona, like you were mentioning online education. This has been proven in many cases to be just as effective as, in-person lessons. So I think that still valuing a lot the human contact and the social environment and the possibility of interacting on one-on-one. But I think that this is a very feasible option for like PhD programs, graduate programs, where people are attending from all over the place, and rather than commuting, they can just attend over the internet, over their own computer at home. Or the teachers can present.
Mm-hmm.
We know that a lot of people in academics have to travel, for work, congresses, and everything. So imagine, being on the other side of the planet, but still being able to give, a class, to give a presentation.
Yes.
This is important because it really expands our possibilities to do what we did before with more sacrifices, with more adjustments that, like your friend said, came with a heavy toll for our body.
Yep. Well, we had discussed earlier about talking about another subject, and I'd really like to, but I have an idea. This has been a great, nice COVID-19 conversation, and how do you feel if maybe we keep it at that for this, and we could do another separate one?
Yeah, with pleasure. Always a pleasure to have a nice chat with you.
Well, you too, and I really want to talk about the other subjects as well. But do you have? I didn't tell you I'd ask this because I don't ever script anything beforehand. Any takeaway message regarding what you just talked about with COVID?
Well, if we want to summarize that in a few key points, I would say that this is hitting everybody, but at the same time, everybody can do something. So each one of us could be a responsible individual and responsible citizen, and follow the guidelines for social distancing. It's very important for ourselves and for the people around us. I think that we didn't mention this, but I think we should really acknowledge the huge work of people in healthcare right now all around the world.
Yeah.
They are really fighting on the front line this battle, and most of them, unfortunately, are paying with their own lives. I think this says a lot about the dedication, the mission of these people, and how valuable is the service that they're providing to the community. So let's not forget this, because many times we are probably too quick to criticize the healthcare service that we receive, or the fact that doctors or nurses seem too busy, or they don't dedicate us enough time. We're very, quick to criticize them, but let's not forget that they are providing a critical service to everybody. And right now they're out there saving lives and, risking their own. So
Yep.
we didn't discuss this because probably we didn't want to be too dramatic, but I think we all need to take a moment and acknowledge and recognize that.
I really appreciate you saying that too. I thought that myself, and I'll just say it's because my son is ER doctor, his wife's nurse practitioner in a different hospital down the road, ER. And their stress load level is like I've never seen. And residency is tough anyways, right? But this on top of that, it's like nothing they've ever seen or anyone has ever seen. So that's actually given me, I feel really bad for them, actually. I feel horrible, and I pray for their safety and that they're okay. But not just them, everybody. Because there's so many, we have people here, and people from the South too. I don't know if anybody in your area, but people from here, they went to New York City, nurses and people, doctors volunteering to help out because it's so bad. Now that right there, that's to be commended as well. I mean, they're putting their lives on the line and they're volunteering. So yes.
And then I have one last comment.
Yes.
It's another thing that we didn't discuss, but I think it's worth of consideration. The situation is bad enough. We don't need to give any credit to a lot of fake news or word plot theories, for sabotaging, this country rather than another. I don't want to be too technical, but let's just stick to the facts. This is a terrible pandemic hitting everybody. But the fact that there have been warnings before from the scientific community doesn't mean that people planned this. It actually means that we need to listen more to research, because they've been warning us about this and other similar scenarios, like the problems related to the abuse of antibiotics that might eventually select a super strain of bacteria. This is too long, let's not go there. But the problem is that we were not prepared, and we've been warned before many times, and unfortunately there were no decisions taken to adjust to a scenario like this. It looked too much like sci-fi to really pose a significant threat. Well, now we're living this.
Yeah, we're living it. No matter where it started, right? We're in it. Yeah.
Exactly. And so, if among the several other lessons, let's try to learn a lesson about trusting a little bit more the people that are working on this, and they're saying, guys, we might be facing something like this, so let's get ready.
Yeah. Well, that's really good, great words of wisdom, and you always learn a lot from you, but in addition to that, my perspective shifts a lot of times when I talk with people, and you, when you said, you hear stay home, social distance, keep your distance, wear a mask. That's all fine, but take responsibility. You saying that, it just ties it in for me even more so to make me realize how important it is. Because it's funny. My wife and I were just talking yesterday. My son has 4 days off somewhere near the end of May. So I wonder if we can go and. But wait a minute, it's only a few weeks away. No, we're just not going to happen, because even if we did go, if we came back, would we be proud to say what we did and where we went when we get back? No. So you can't do that. So it's not going to happen. The thought is a knee-jerk reaction. Oh, yeah, let's go, because that's what we would do in the previous. Yeah, not now though. So responsibility.
I've been living the same experience. Thinking about my mother and the rest of my family. Of course, the first impulse is to jump on the plane and go there. Be with them. Helping them. To go out and buy grocery and just be of any support, of any help. But then the thing is like, no, this is not the wise behavior.
Right.
Everybody should stay home, and everybody should try to manage with what they have. And really, we didn't really explain why social distancing is so important. And I don't know if we have time for that.
Oh, I have another 59 minutes left.
Oh, okay. Yeah. I can go on and on. I always enjoy, talking, but
no, we don't have a time limit for the next hour. I have a 1 o'clock appointment. That's all.
Okay, but the thing is that the main concept, in few words, is what they say, flattening the curve.
Yep.
It's not just about spreading the contagion of the virus because you don't want to get sick, but it's because of all the people that get the virus, 10-15% might require hospitalization, and a smaller percentage of that might require ICU.
Mm-hmm.
So there is only a limited number of beds in the ICU units, all around the world. Let's talk about countries, let's talk about states, let's talk about counties. But if you live in a county where you have 2 major hospitals and they have 50 ICU beds each,
mm-hmm.
and you are not observing social distancing, you might have every day 100 new cases in that county. Mm-hmm. And so just for sake of the numbers, just to use the same model. So let's say that 10 of that 100 cases will require ICU. So every day you have 10 new cases that will get into ICU. But you have 50 beds in one hospital, 50 beds in another. So in 10 days, you have saturated the capacity of those hospitals in that county to provide services. It's not like they don't want to, but once the beds are full, and most of the times you can't manage, a person in ICU in a few days. If you're able to keep him alive, it might take more than that. So what's going to happen next? People cannot be treated properly. Right. So by flattening the curve, you really give a powerful instrument to our doctors, nurses, and other healthcare professionals to give you the better services, to give you what you need to stay alive. Because once you've saturated the hospitals, what are you going to do? I mean, you don't have a ventilator at home, and so people will not be treated properly, and unfortunately, they will die. So this is the ultimate, effect of staying home, of flattening the curve. If you have, instead of 10 cases per day, 10 new cases per day, if you have, 100 new cases per day, you have 10 cases per day. And then of those 10%, so one case ends up in ICU, then you're gonna need 100 days to fill up those 100 beds of ICU for those 2 hospitals.
Right.
Mm-hmm. 100 days in the meanwhile, the patient hospitalized on day 1 might be treated, so might be able to go home. So you free up, other beds, so they can handle the emergency much better.
Right. That makes sense. That puts a lot into perspective about what's happening in various cities around the country and various hospitals.
Exactly.
And they're building hospitals and stadiums and things now. So it's, yeah, just unprecedented, as they say. It's the word of 2020, it seems, but it's appropriate.
Yeah.
Well, Luigi, thank you. I really appreciate your wisdom, your taking the time too, speaking of time, because I know you're really busy.
It's always a pleasure. So thank you very much.
Well, you too, my friend. So if you don't mind, I'm going to end the meeting or the recording, but stay on with me for just a minute, if you will.
Sure.
Yeah, again, thank you, Luigi. Thank you, everybody, for watching and for listening. This was very informative to me. Definitely caused me to wrap my mind around this in a little bit different, more comprehensive way. It helps to draw things in, time in, and make sense of it all so I can actually take more responsibility. And I really like how you address that too, because responsibility is something we can all exercise. So, and we should. All right, thank you. And
thank you for listening.
yeah, thank you very much. Have a fantastic day, everyone.